I'd like to ask your permission to use this video for educational purpose and on internet.
Yes, you have permission.
Thank you. Tell me about first your symptoms before the surgery.
Okay. I've had back pain for probably at least 10 years, but the worst of it was the last 2 years. And I had seen a surgeon who refused to do surgery on me.
Why did he refuse to do surgery on
I
you?
think it was because of my size. I am obese.
Yeah.
And I was so disappointed. But then I saw an ad for Inspired Spine
Oh, thank you.
on Facebook.
Oh, good.
Yes,
Okay,
yes.
Now,
So
tell me about your symptoms. What were your symptoms?
I was very difficult to move. It was difficult to walk. I had terrible lower back pain, and I even had some SI pain.
Yeah. How bad was that pain?
It could be a 10.
So a 10 pain, we call that when you break a bone or giving birth.
Okay.
And people who don't have it, they cannot wrap their head around how one can live with that kind of pain. Tell me, how was your life?
I was pretty much stayed at home.
Mm-hmm.
I didn't do social things very often.
Mm-hmm.
If I did, I had to know how long I was going to be gone, and if there was a place I could sit down and rest.
Was it livable?
It was not livable.
And
It was
how
not.
did you feel that the other surgeon told you, I cannot do surgery, you just have to live with it? That's what you are told, right?
I was very disappointed, and I went home and cried. And he was very rude to me as well.
Okay, well, once you tell a patient you cannot help them, it is just that sort of it's sad as well for a surgeon
Yes.
to be able to have to tell that. And sometimes, unfortunately, sometimes we cope with that for us emotionally, remove ourselves from the relationship.
Oh, I imagine.
Yeah, and that is sometimes just a bad situation that we have to tell our patient we cannot help them now. So
He
you said
could have said to me, after you lose some weight, come back and see me. But he didn't even say that.
no. I'm sorry to hear that. Now, the fact is that maybe that's a good thing for you that he didn't do the surgery, because we know that when you're on the have a higher BMI, if the weight is higher, this surgery can be extremely risky.
That's what I've heard.
Yeah, but we could do the surgery because we did the surgery to a tube that was barely thicker than this pen. For that reason, we could do this surgery with much, much less risk. As a matter of fact, your surgery was done under 1 hour, and our blood loss was barely less than half a cup of coffee.
Yeah.
That's all we did. How long did you stay in the hospital?
2 days.
2 days. Now, our surgery.
Maybe it was 3 days.
Yeah, I can look it up actually.
Yeah, I think it was 3.
But we could do the surgery and we sent you within reasonable time from home. And this is what we did. We did a 2-level fusion for you, and the surgery went really well. But after the surgery, you had some new problem. Tell me about your leg.
Yes, my leg was very weak.
Mm-hmm.
I think it was from the nerves being moved.
Yeah, you remember we talked about before the
Yes,
surgery
yes.
that may happen. What do you remember? What did I tell you?
You told me that you have to move the nerves aside to get to where you need to do the surgery, and to expect some numbness, which I had when the first time I got out of bed after surgery.
Mm-hmm.
My leg went out from under me.
Yeah, well,
wouldn't
it was
support
even
me.
weak, yeah.
Yes, very weak.
So I just examined you. The strength is full. How is the feeling of the leg?
Good.
Yeah, so that
Good.
symptoms we are about 3.5 months after the surgery. The weakness that we talked about, that there is 15% risk of that, but most of them is just the numbness. You had even more than average patient. You had even weakness there. Now, when do you think the numbness and the weakness did go away after the surgery?
I would say in about maybe 6 weeks.
6 weeks.
It didn't take very long.
Okay, well then that is exactly what I say my patient, that usually takes about 1 to 2 months, about 4 to 8 weeks before it start getting better. But at that time it was already better. That's the best sign we can have now. Most importantly, you said you had some leg pain before the surgery.
Yes.
Do you have that leg pain?
No.
That is what we call the best prognosticator, meaning that it's a sign that we took the pressure off and everything going the right direction.
Yes.
How's your back pain?
The only time I have back pain is if I stand too long. But the pain I had before surgery is 100% gone.
Okay.
I can't tell you how happy I am with that.
Oh, I'm happy to hear that. I'm happy that we could help. But the reason I could help you is because I went for years and years more education to be able to do this
Yes.
surgery, and
Yes.
I offered many of my colleagues to come and learn this. And many of them are too busy with their daily life, so they end up telling patient in your situation, that you have to live with that. And
Yes.
I'm sorry to hear that, but in a way, they are in a way right that their surgery is too dangerous for you.
Yes.
So it's a good thing that
Yeah.
he didn't do the surgery for you. Okay, but I think what I could just say, if I could, that like as a learning experience, I could tell that surgeon that if he cannot do the surgery, he should look for somebody who can do the surgery
Yes.
for you. I think that would be fair to ask.
I think so.
Well, what other question or comment do you have? What made you? You said you found us on Facebook.
Facebook.
Yeah, tell me what made you to come and see us.
When it said that people with a higher BMI could still have the surgery,
And we can prove that.
and you did it. Yes.
You are not even on the, you are way far away from the highest level of BMI that we have been treating. And our data shows we can provide the same safe surgery to you
Yes.
than somebody who's on the lower BMI or weight. So I'm happy it worked. I'm happy you came.
I am too.
Well, thank you so much. I
too.
appreciate that.
Thank you, Doctor.
Okay, you're welcome.